Hello, ladies and gentlemen. It's not often that a single decision from one leader can change the course of a global health emergency. But today, we are at that crossroads. For decades, the world has been fighting a virus that once felt impossible to stop. AIDS devastated families, cities, entire nations. But what was once a death sentence is now a manageable condition if the right systems are in place. For decades, AIDS has been one of the world's most devastating public health challenges. Entire communities have been shaped by the impact of the virus, lives lost, healthcare systems stretched thin, and economies strained. But where once there was only fear and uncertainty, today there is something extraordinary, a set of tools that are not just effective, but transformative. These tools represent one of the greatest achievements in modern medicine, and for the first time since the epidemic began, we are not just talking about treatment. We are talking about the realistic possibility of ending the AIDS emergency altogether. This kind of progress doesn't happen overnight. It's the result of years, decades of collaboration between scientists, healthcare professionals, governments, and global health organizations. The journey from the early 1980s, when AIDS was still shrouded in stigma and misinformation, to where we are now, is a testament to what happens when humanity decides not to give up. And now, because of that persistence, we have antiretroviral therapies that are affordable, scalable, and astonishingly effective. These therapies don't just prolong life, they suppress the virus to undetectable levels, which means they also prevent transmission. That's not just medical progress, that's a shift in the entire trajectory of an epidemic. Even more promising are the advances in prevention. Pre-exposure prophylaxis, or PrEP, is a once daily pill that drastically reduces the risk of contracting HIV. In many clinical trials, it has been over 99% effective when taken consistently. And that means we're no longer just reacting to HIV diagnoses, we're actively preventing them. That alone could change the future for millions of people around the world. Testing has also undergone a revolution. Where once it could take weeks to get results, we now have rapid diagnostic tests that deliver results in less than 30 minutes, often without the need for a lab. That immediacy is critical, because when people know their status, they can take steps immediately, whether that means beginning treatment, initiating prevention strategies, or connecting with others for support. Fast testing means faster action, and faster action saves lives, and the innovation doesn't stop there. We're seeing mobile health technologies, artificial intelligence models that predict outbreaks before they happen, and digital tools that track treatment adherence with remarkable accuracy. All of these innovations are being integrated into public health programs with greater speed and effectiveness than ever before. We are no longer experimenting, we're implementing. But having these tools isn't the same as using them. The science is ready, the systems in many places are not. There are still too many people, especially in underserved communities, both in the U.S. and globally, who don't have access to testing, prevention, or treatment. This is not because the tools don't exist, but because the systems needed to deliver them are underfunded or underprioritized. That's a logistics problem, not a medical one, and logistics problems can be solved. It's worth pausing here to recognize just how rare this situation is. In most global health emergencies, the challenge is that we don't yet have the tools we need. With malaria, for example, we still need more effective vaccines. With tuberculosis, we need faster diagnostics. But with AIDS, we have everything required to end the emergency if we can get those tools to the people who need them. That's an opportunity unlike any we've ever had in public health. So the question becomes, how do we ensure that these tools reach the last mile? That's where leadership matters. It takes a deliberate, well-funded, and sustained effort to build clinics, train health workers, ship medicines, and make sure the supply chain never breaks. It requires coordination across borders, across political lines, and across public and private sectors. And it requires a sense of urgency because every day that goes by without scaling these solutions is another day when lives are unnecessarily at risk. This moment is fragile, but it is also powerful. We are no longer waiting on innovation to catch up to the crisis. Innovation has done its part. Now it's about execution. We have everything we need to end the AIDS emergency: the medicine, the prevention tools, the diagnostics, the data. What we need now is the commitment to put those tools to work everywhere, for everyone. This is a pivotal point in history, not because we're still searching for answers, but because, finally, we have them. Throughout history, major breakthroughs in public health have often come not just from science or medicine, but from leadership. The ability to take what we know works and bring it to scale across borders, across populations, across bureaucracies, has always depended on the people in power. And when it comes to ending a global emergency like AIDS, the influence of a single national leader, particularly the President of the United States, can be the difference between progress that inches forward and progress that accelerates with real momentum. There are moments when leadership becomes a force multiplier. The decisions of a president can create ripple effects through public health agencies, international partnerships, and the private sector. That's because when the highest office in one of the most powerful countries signals a priority, the world pays attention, budgets are reshaped, diplomatic conversations shift, strategic plans are redrawn. And most importantly, the sense of urgency around a problem becomes real. It's important to understand what kind of impact that influence can have. For example, when major U.S. administrations have committed to global health efforts in the past, whether it was to combat smallpox, expand childhood vaccination, or fight malaria, the results were dramatic. Whole systems were built to distribute care. Entire supply chains were constructed and optimized. Millions of lives were saved. That didn't happen by accident. It happened because someone at the very top said, "This matters," and right now, the world is at a point where that kind of decision can alter the course of the AIDS epidemic. Not because the challenge is over, but because it's finally manageable. We're not talking about curing the virus tomorrow. We're talking about applying what we already know in the most effective and widespread way possible. And for that, we need scale, we need visibility, we need coordination. That's where the influence of a president comes in. This isn't just about funding, though funding plays a crucial role. It's about signaling that this issue is a national and international priority. When a president backs a cause, it gains not only resources but legitimacy. It moves out of the margins and into the mainstream of political discourse. That makes a difference because stigma still exists and silence still kills. When a leader uses their platform to talk openly and clearly about AIDS, not just in terms of fear or tragedy, but in terms of solutions and hope, it changes the conversation. It opens the door to action. Beyond rhetoric, there are concrete policy levers that a president can pull. There's the power to direct federal agencies to coordinate better and respond faster. There's the ability to negotiate international partnerships and lead multi-country coalitions. There's the opportunity to support programs that have already proven their worth, like the President's Emergency Plan for AIDS relief, or to push for new models that reach underserved communities more effectively. These are not abstract powers. They are practical tools of governance, and when used intentionally, they save lives. The most striking thing about this moment is that it offers a chance to lead in a way that history will not forget. It's not just about legacy in the traditional sense. It's about stepping into a vacuum that demands leadership and doing something transformative. We've seen that before, and when it happens, the impact stretches far beyond one administration. It reshapes global health infrastructure for a generation or more. What's also critical is that presidential leadership sends a message to other sectors. When a president prioritizes AIDS, business leaders start asking how they can help. Philanthropic foundations align their strategies. Researchers push for new innovations, knowing there will be support to bring them to life. NGO and community organizations gain the backing they need to do the work they've been doing for years on the ground. This kind of alignment doesn't happen without a catalyst. The office of the president can be that catalyst, and while this kind of leadership takes vision, it also takes courage. It's not always easy to commit to long-term goals in a short-term political environment. But that's exactly what's needed. The fight against AIDS is not something that will be won with a single announcement or policy memo. It requires sustained attention, measured progress, and a willingness to stick with it. When that leadership shows up, it's contagious. It builds belief across systems and across people. We stand at a rare and powerful crossroads. The science is ready. The tools are here. The opportunity is real. All that's needed is the kind of influence that only true leadership can provide. And when that influence is used for bold, compassionate, data-driven action, it doesn't just turn the tide, it changes the future. One of the biggest misunderstandings people still have about global health is that it's a form of charity, something you do to feel good, or to be generous, or because it's the right thing. That's a narrow way of thinking, and in many ways, it misses the full picture. The reality is that investing in global health is one of the smartest, most high-return decisions any government, business, or institution can make. It's not a donation. It's a strategic investment in a safer, more stable, and more prosperous world. When we look at the impact of health interventions, the numbers are striking. Healthy people live longer, earn more, stay in school longer, and are more productive over their lifetimes. They raise healthier families. They participate in economies, contribute to innovation, and help grow the middle class. When a country improves its health infrastructure, its GDP per capita increases. That's not just a humanitarian outcome. That's economics, that's stability, that's growth. This is especially true when it comes to tackling epidemics like AIDS. For many years, AIDS was viewed as an emergency that needed short-term relief. But now we understand that controlling AIDS strengthens entire health systems. It helps countries build out clinics, train healthcare workers, develop lab networks, and improve supply chains. These improvements don't disappear when the epidemic is over. They stay in place and support responses to everything from maternal health to future outbreaks of disease. In other words, the infrastructure built to fight AIDS is infrastructure that strengthens global resilience. There's also a powerful geopolitical dimension to this. When a country leads in global health, it earns trust. It builds relationships. It establishes influence that doesn't come from military might, but from partnership and shared humanity. That kind of soft power is incredibly valuable. It creates diplomatic bridges. It increases cooperation. It sends a message that the country cares about more than just its own borders. It cares about the well-being of others. That kind of leadership is remembered. It opens doors in times of crisis and in times of opportunity. And yet, despite all of this, the investment case for global health is still too often framed through the lens of charity. That mindset limits what's possible, because when you treat global health as a side project, you miss the chance to integrate it into national security, economic development, and global innovation. The truth is, every dollar spent on fighting AIDS, or eradicating malaria, or increasing childhood vaccination rates pays dividends not just morally, but materially. Take the fight against HIV. For years, programs that provided antiretroviral therapy, condoms, and clean needle access were framed as compassionate efforts, and they are, but they're also incredibly cost-effective. They reduce the future burden on healthcare systems. They reduce absenteeism in the workforce. They prevent orphanhood, which has major economic and social consequences. They reduce the likelihood of secondary epidemics, including tuberculosis and hepatitis. These are all tangible, measurable outcomes, and they result in real savings not just for the countries receiving the aid, but for the entire global community. When one country experiences a health crisis, it rarely stays contained. We've seen this again and again. Disease spreads, instability spills over, health insecurity becomes national insecurity. So investing in strong health systems isn't about being generous, it's about being prepared. It's about making sure we don't all pay the price for problems we could have helped prevent earlier and more efficiently. There's also an innovation feedback loop. The more we invest in global health, the more we drive scientific research, accelerate medical breakthroughs, and push the boundaries of what's possible in diagnostics, vaccines, and treatment delivery. These innovations don't just help in poor countries, they improve care everywhere. Many of the technologies we rely on in wealthy nations today were born out of global health challenges that required creative solutions under pressure. The return on investment in global health is unusually high, not just in the long term, but in the near term too. It makes the world healthier, safer, and more equitable. And those things are not abstract ideals. They are the foundations of functioning markets, effective governance, and sustainable development. They are the preconditions for peace, for progress, and for possibility. So when we talk about ending the AIDS emergency, the framing matters. It's not about generosity, it's about vision. It's about understanding that a world without AIDS isn't just a better world morally, it's a stronger, more prosperous, more resilient world economically and strategically. That is what makes this moment not just an opportunity, but an imperative. The progress we've made in the fight against AIDS didn't happen by chance. It came from decades of learning what works, what doesn't, and how to turn small victories into global momentum. The solutions we have today are built on a foundation laid by earlier effort, some experimental, some risky, but all driven by the same goal: to stop the spread of a virus that once felt unstoppable. Those past successes are more than just chapters in a history book. They are proof that when the right resources, strategies, and leadership converge, even the most daunting health challenges can be tackled at scale. Consider how the world responded at the height of the AIDS epidemic. In the early 2000s, antiretroviral therapy existed, but it was largely inaccessible to the people who needed it most. In sub-Saharan Africa, entire communities were devastated while treatments were sitting on pharmacy shelves in wealthier countries. It was a moral failure, but it was also a logistical and political one. Then came a pivotal shift, programs that changed the rules of the game. One of the most powerful examples is the President's Emergency Plan for AIDS Relief. When it launched, it was bold, ambitious, and at the time unprecedented. Suddenly, resources were moving where they were most needed. Millions of people gained access to life-saving treatment. Countries that once had little health infrastructure were able to build and scale national responses. Clinics were constructed, doctors trained, systems strengthened. PEPFAR didn't just save lives, it created a platform for delivering healthcare more effectively across the board. The Global Fund followed a similar trajectory, bringing together governments, civil society, and the private sector to finance responses to AIDS, tuberculosis, and malaria. It proved that multilateral cooperation could work, especially when grounded in data, accountability, and local leadership. These initiatives didn't just deliver medicine, they delivered results. Millions of deaths were prevented, millions more infections were avoided, entire generations were protected. That's not an abstraction. That's impact at the most human level. These aren't just feel-good stories, they're strategic case studies. They show what's possible when science, funding, and global coordination come together with urgency and discipline. And more importantly, they show us how to do it again. We now have a playbook. We know that focusing on high burden regions delivers the highest returns. We know that integrating services so people can get tested, treated, and supported in one location leads to better outcomes. We know that engaging local communities improves trust and uptake. We know that collecting real-time data makes interventions more agile and effective. These are not guesses anymore. They are hard-earned insights from programs that have been tested in some of the most challenging environments on Earth. And because of those past efforts, we are now in a position to act faster, scale better, and reach further. We don't need to start from zero. We're standing on the shoulders of past initiatives that have built laboratories, supply chains, surveillance networks, and community outreach systems that are already in place. All of these assets can be leveraged and expanded, not just to fight AIDS, but to build long-term health security. We've also learned that sustained political will is essential. When programs like PEPFAR received consistent backing, their results multiplied. When that support wavered, progress slowed. This tells us something critical. Success in global health is not just about finding a solution. It's about staying committed to implementing that solution year after year across changing administrations and political climates. There's another lesson here as well about transparency and accountability. The programs that have performed best are the ones that constantly measured what they were doing, shared what they learned, and adjusted based on what the evidence showed. That mindset of continuous learning and adaptation has to be at the heart of every future effort, because as the virus changes and as populations shift, the ability to pivot quickly is no longer optional. It's essential. All of this points to one simple but powerful truth. We know how to win this fight because we've already made enormous progress. We've seen the model, we've tested the systems, we've watched the curve bend. The task now is to accelerate, to reach the people still being left behind, and to finish what decades of investment and innovation have started. The past is not just a record of what happened, it's a map of what's possible. If we follow the path carved by previous success, while staying flexible, informed, and ambitious, we can do more than manage this epidemic. We can end the emergency, and that will stand as one of the most important achievements in public health history. Moments like this don't come often. A point in time when science, technology, infrastructure, and experience all align to make something that once felt impossible, possible. Ending the AIDS emergency is no longer a dream. It's a decision about how we act, how we prioritize, and whether we choose to step up or step back. And history, as it always does, will remember who showed up. It's easy to believe that progress is automatic, that once we have the tools and knowledge, change is inevitable. But that's never been the case. In global health, the difference between success and failure often comes down to will. Not medical will, not technical will, political will, social will. The willingness of people in power to say, we can do better, we will do more, and we won't stop until this is over. That kind of leadership matters because people remember it. The legacy of a generation is shaped not by what it inherited, but by what it chose to build. In the fight against AIDS, the tools are here, the programs are tested, the cost of inaction is clear, and the benefits of bold action are undeniable. So the real question now isn't about capability, it's about character. When you look back at major breakthroughs in history, the eradication of smallpox, the rapid scale-up of childhood vaccinations, the response to Ebola, what stands out isn't just the science. It's the people who stood up and said, "This matters, let's do something." Those moments weren't easy. They required risk, persistence, and a long-term vision. But because of that courage, lives were saved, communities were strengthened, and the course of history was altered. The same opportunity exists now. We are at a point where we can shift the trajectory of AIDS permanently. That doesn't mean every problem disappears overnight. It means the emergency ends, the epidemic becomes manageable, the future becomes more predictable. That is a powerful shift, and one that will ripple across generations. Millions of people who haven't even been born yet will live longer, healthier lives because of the decisions we make now. But that only happens if we act, and action requires more than statements. It requires budgets, programs, partnerships, and accountability. It requires leaders in government to prioritize global health not just in speeches, but in legislation. It requires the private sector to ask not just how they can donate, but how they can innovate. It requires the media to cover AIDS not just as a tragedy, but as a solvable challenge that deserves attention and focus. And it requires citizens to raise their voices and demand better. This isn't about one country or one leader, but certain voices do carry farther. Certain platforms have the power to shift global momentum. When a president, a CEO, a philanthropist, or a cultural icon steps up and says, "This matters now," it can turn a slow movement into a fast one. It can bring urgency to a cause that too often fades into the background. And that's what we need in this moment. Not just quiet progress, but visible commitment. That visibility is more than symbolic. It builds trust. It breaks stigma. It encourages those on the front lines, doctors, nurses, researchers, and community organizers, by showing them they're not alone. It brings momentum to global partnerships that rely on coordination. It inspires new generations to care, to participate, and to carry the mission forward. And one day, when the AIDS emergency truly is over, people will look back. They will study how it happened. They will ask what made this chapter different from the ones before. And the answer won't just be about medicine. It will be about people, about those who had the power to help and chose to use it, about those who didn't wait for perfect solutions but worked with what they had, about those who didn't need to act but acted anyway. In the end, progress isn't just measured in numbers, it's measured in courage, in the willingness to lead when leadership is hard, to care when it's easier not to prioritize lives you may never meet because you understand that our futures are connected. This is that moment. This is that decision, and when the history books are written, they won't just talk about the virus. They'll talk about who rose to meet it. This is a rare moment, the kind that comes once in a generation. The question isn't can we end AIDS? We can. The question is will we, and who will have the courage to say, "It ends with us." Thank you.